Hi, this is Till, and the Thinking Practitioner Podcast is supported by ABMP, Associated Bodywork and Massage Professionals. ABMP membership gives professional practitioners like you a package including individual liability insurance, free continuing education, and quick reference apps, legislative advocacy, and much more. ABMP CE courses, podcast, and Massage and Bodywork magazine always feature expert voices and new perspectives in the profession, including Whitney Lowe, my co-host, who is not here today, and myself, Till Luchau. Thinking Practitioner listeners can save on joining ABMP at abmp.com/thinking. And today's episode has a very personal dimension for me. About 9 years ago, when Loretta Carridan Luchau, my wife and partner of 38 years, was diagnosed with breast cancer, it was really a shock for both of us, obviously. And that journey of being with her through her cancer journey has catalyzed a lot of learning in a lot of ways for me professionally and personally. And one of those was that as her live-in body worker, I had to really retool the way that I did my hands-on work with her. I really had to learn how to work with her differently in the different types of treatment she was going through. She's 9 years later. She's been through 3 surgeries, 2 rounds of radiation. She's just finishing her 2nd round of chemotherapy and about to start a 3rd round of radiation. She is also an accomplished body worker herself. And I've been lucky enough to have her as my live-in body worker when the time is right for that. And I'm lucky enough to have her, along with some other guests, on today's podcast as a guest. Hello, Loretta. Thanks for joining us today.
Hello.
Great. Thanks for being here. I really wanted you in this conversation because as I had to do the retooling that I mentioned, having to recalibrate what I was doing as a body worker with you, your input was so crucial to be able to have your guidance. And then, in this most recent round of treatments you've been going through, I realized at some point, I'm just such a learner, such a beginner at this, that I really want some more input, more ideas, more help. And I'd done some research and reading early on, but went back, hit the books again, and came up with Oncology Massage, an Integrative Approach to Cancer Care. Ordered the book. It came, and I realized it's published by Handspring Publishing, whom I also published a book for, so I didn't even realize that. And so I thought, wow, why don't I talk to the authors, Janet Pinney and Rebecca Sturgeon, about this whole journey that I'm on and see if there's anything useful for other people as well. So Janet Pinney and Rebecca Sturgeon, welcome very much. Janet, let's start with you if we could. You are a registered massage therapist. Thanks for being here today. Anything else you can tell us about yourself?
Absolutely. I've been a registered massage therapist in Ottawa, Canada for about 15 years. It took me an excruciating 7 or 8 years to complete the training, which is usually 2 or 3 years here in Ontario. But a mix of children being born and parents dying it took up a lot of time. So it took me forever to complete the program. And when I finally did, I didn't even have a clue if I still liked massage or not. So there I was, newly registered, and started working. Unfortunately, found that I absolutely love it, and I have never tired of it. About 7 or 8 years ago, I got the opportunity to work at an integrative cancer center here in Ottawa, which was really one of its kind at the time. And there I got embedded in integrative cancer care and really started to understand not only what massage therapists could bring to people living with cancer, but what naturopaths and traditional Chinese medicine practitioners, acupuncture, yoga therapy, on and on and on together could help really support the health and the healing of people living with cancer. A few years into working there, I got the opportunity to work on the book with Rebecca, Oncology Massage, and the rest is history at this point.
Oh, and I'm so pleased that you accepted my invitation and can talk me through these things. And Rebecca, I first met you through your work with HealWell as their education director. You're also a massage therapist, huh?
Yes.
what else do you want us to know about you?
Well, as you said, I'm the education director for Heal Well and also the producer of Heal Well's podcast. So it's nice to have this podcast trade with you today. I started Oncology Massage as an escape from my spa job. We were given the opportunity to take the training and work somewhere that was not the spa, which I thought was amazing because I'm not suited for spa work. Never thought that it would be the thing that I ended up loving the most. Through a various circuitous journey, started teaching oncology massage continuing education, first for an organization called Greet the Day, which is based in California, and then for Heal Well, and eventually became Heal Well's education director. And through that, got the opportunity to work with Janet on this book, and to kind of just come in when the book proposal had already been written and help with this project. So in addition to my work with Heal Well, I'm also a writer and in other genres, and I'm very grateful to be here today.
Grateful that you're with us. And you're both educators, you're both writers, and probably this idea for me came from a moment where I'm just thinking, okay, I could just really use some help and support here in figuring this out. So it came from a personal place. But then as I start to expand it and think, how can we have this conversation here in this format, and ask the main question is, what do massage or manual therapists need to know about working with people with cancer and cancer treatment? I just want to, as we lead into that, I just want to acknowledge that you as educators, I don't know if you feel this way about it, but when people ask me that kind of question about things that I teach, the answer, I always have to pause from them, because the answer is always, well, get some training, of course, and get a lot of training. And to think that maybe in an hour podcast, we could even do something that was useful, important, and responsible is maybe a tall order. And yet, nonetheless, I want to try, with the full acknowledgement that there's a lot, it's such a big field, and I appreciate that the more I look into it, that I really understand that, and I imagine that a lot of the answers are going to be lead-ins to much bigger conversations.
Well, yeah, of course. I mean, we have a joke at Heal Well, but it's actually true that the answer to every question is it depends.
Yeah.
So the answer to that question is it depends.
Right. It depends.
Yeah.
Well, depend or not, my hope is to, again, come away with some pearls for myself, but also just help the listeners with some ideas or tools or awarenesses that will help them when they have someone come to them that's living with cancer and cancer treatment.
Yeah.
So what would you say? What are some of the essential things that we need to know as practitioners?
You need to know what you don't know.
You need to know what you don't know.
Yeah. And hold what you don't know. And you need to know how and when to ask questions. I mean, obviously there's information, and as you acknowledged, Till, it's more than we can cover in an hour conversation. But we've said before, and I know I said this to Janet so many times, she probably wanted to punch me through Skype, but our book is really about critical thinking. And Oncology Massage is really about critical thinking, more than almost anything else. What would you add, Janet?
Critical thinking for sure. And when I'm offering short webinars on this subject, I always want to give people a strong foundation, because when a client comes in, they can come in with emotional complexity and very complex signs and symptoms. So how do we take all that information in a short period of time and give a treatment that's at least safe, if not safe and effective for what they're bringing in and hoping to have worked on? So we use critical thinking, but we also want to have a fairly broad knowledge of biomedical cancer treatments and how they impact the body, especially the soft tissues, which is what we work with. We want to really look at the basic oncology massage principles of pressure adaptation, the site that you work on, the duration of the treatment, and the duration of time you spend on a given area of the body, as well as positioning. We want to always think three-dimensionally, because cancer treatments have an impact throughout the entire body. If you think of radiation treatment, it not only has its entry point, but its exit point as well, and it impacts everything in between. So we need to be thinking beyond just the skin and the muscles that we're feeling under our hands, and think about the blood vessels and the lymphatic vessels and the organs that are underneath that, and how they might have been impacted by the radiation, and how that might impact some of the signs and symptoms that the person's bringing in. And finally, we can use the stages of healing as a guide for our treatment. So if somebody's just had surgery and it's a few weeks after the surgery, that stage of healing, it's too early to work directly on the area that's had the incision. So we want to make sure that we're always respecting and supporting the body as it heals.
Okay, that's a great outline, and that's a good framework for a discussion. So where do you want to start? What's the most important thing to unpack there?
Oh, tough question. So something I came across recently, I get research sent to me routinely, and this was a research study called Manual Therapy for Patients with Radiation-Associated Trismus After Head and Neck Cancer.
Trismus.
So the difficulty opening the jaw, which is often impacted by the radiation treatment to the head and the neck. And I didn't want to pay the whatever amount to read the article. So I contacted one of the lead authors and asked if she would send it to me. So we started a dialogue, and her name is Holly McMillan, and she's given me permission to use her name when I talk about this. She's a speech language pathologist and a certified lymphedema therapist at MD Anderson Cancer Center. And this is what she wrote to me in one of her emails. She said that after all of her education, she went back to school to obtain her massage license because she thinks it plays a critical role in cancer recovery, and she can't remember how to treat a patient without some sort of massage therapy intervention. So I love this interchange for a whole bunch of reasons. One is the incredible work and the detail that was in the study in terms of supporting manual therapy, dealing with radiation trismus after head and neck cancer treatment, but also the fact that as a researcher and a speech language pathologist, she truly is integrative for us, and she brings a perspective that we can't have as massage therapists. I guess.
You're saying a couple of things. You're saying, we got to be humble. We got to realize even when we looked at everything, there's still more to know.
Yes.
And you're also saying there's a role for massage or manual therapy in all kinds of treatment, all kinds of recovery processes from these treatments.
Very much. It was very affirming of that.
Yeah.
Mm-hmm.
That's great. Okay. So how about pressure? What about pressure? You listed it as one of the things that was important to talk about. And
Absolutely.
You mentioned, Tracy Walton's pressure scale.
Yes.
What can you tell us about that? It's important for us to know.
It's so vitally important, and we're so grateful, eternally grateful to Tracy Walton for allowing us to use her pressure scale, because it is, unlike other ways that manual therapists describe the pressure they're using, it is an objective, reproducible scale that is based on which tissues you are touching and how your body is approaching your client or patient's body.
Yeah.
It is one of, I think, the most vitally important adaptations is to be able to modulate and accurately and consistently modulate the pressure on someone's tissue, someone's body, because of the effects of cancer treatment, that even local treatments can have systemic effects, and even treatments that happened months or years ago can continue to have effects on the tissues of the body. So Janet was talking about thinking of the body three-dimensionally. I would say you also think about not just, as Janet was saying, working with the soft tissues, but really the nervous system as being one of the most important systems that we affect, and the way that you modulate pressure definitely affects the nervous system and affects the body systemically. So that's, I think, one of the most important hands-on adaptations to oncology massage.
Yeah,
is to understand the role of pressure. Is it as simple as the lighter the better? No,
it is absolutely not that simple. Yeah. And Loretta, I would love to hear your thoughts on this as
Loretta, you were
well,
shaking your head no.
as
Also,
someone who
yeah.
has received.
Right. Well, it's like, I think, Rebecca, you said earlier, it really depends, right?
Yes.
On what part of the
Yes.
body we're touching,
Mhm.
Is it the site? Or it depends on where I'm at in the treatment in terms of pressure too. Yeah.
Exactly. Exactly. And it depends on things like how your individual body is responding to treatment, right?
Yeah.
Yeah.
Mm-hmm. I'm going to name this episode "It Depends," I think.
Please do.
But let's take it another level, because that can be a conversation stopper too. That can stop us from really going into it depends on what. So
Well,
what does pressure depend on?
Pressure depends on how someone's body is responding to treatment. So we talk in the book also about like using the quote unquote medical model as a way to inform critical thinking. And that includes things like asking questions about people's activity levels and have they modified their activity levels. So for example, the way you modify pressure for someone who is used to running 20 miles a day, who in treatment is only running 10 miles a day, might be different than the way you modify pressure for the person who is used to walking a mile a day and now is in bed most of the day, right?
So you turn it down a lot more for that second person.
Right.
Yeah.
So you are always, as with any body work, right? I think we would all agree, you are informed by the population, but you're looking at the individual, and you are working with this individual human as they are right now. So things like current activity level, things like the type of treatment and where in treatment someone is. Are they in the middle of treatment or in what we call active treatment? Was their treatment done a month ago, done a year ago, done 17 years ago?
Right.
We also look at things like what is
with time since treatment being an indicator of how experimental I might be with pressure. Say, if it's been longer, then I can be a little more experimental, you're saying, or what?
Well, say it with me, Till. It depends.
Again,
depends.
This depends on what?
On the types of treatment and how it's affecting their body. So for example, there are things like having lymph nodes removed or in the field of radiation that are permanent changes to the body and to the way the lymphatic system works. It is in fact one of the most important adaptations for oncology massage. There are things like surgical interventions that might affect range of motion or the way that someone's body someone operates inside their body for a long time. Janet always gives the amazing example about reconstructive surgery for breast cancer and how that can affect shoulder scar formation, can affect shoulder range of motion. Also things like if someone is receiving a chemotherapy or an immunotherapy, a drug therapy, quote unquote drug therapy, what is it? What was the purpose of it? And how can it affect the body? So for example, like typical chemotherapy, anti-neoplastic chemotherapy is designed to target fast dividing cells. So the side effects of that can be different than a therapy that is designed to target, that is a targeted immunotherapy.
Yeah.
So it's things like that. It's also things like if someone is receiving radiation, is it external or internal radiation? Where on the body? What are the other, like Janet said, what are the other organs, tissues, systems that can be touched by the radiation? What else, Janet?
Yeah, one thing that comes to mind with the amount of pressure we use is what our clients expect and what they think is realistic. And often people will say no pain, no gain. So they want a very deep treatment, which might be appropriate. I'm not even convinced it is, but maybe it is if you have tight hamstrings after running, but it's probably not appropriate. And it might even be dangerous if you're dealing with the tissue density after radiation. So one of the things we have to do is once we're convinced that we have to moderate the pressure, we also have to educate our clients on what's actually going on in the tissues in their body and why a certain amount of pressure is safe or unsafe for them.
Mm-hmm. So how might you do that with the person that wanted more pressure on their hamstring, say? How might you talk to them, or what might you say?
Mm.
Yeah, well, if they're still running, like Rebecca says, 10 miles a day, then they might have a very deep treatment on those hamstrings, but on the area that's received radiation, it would be much softer. And it's a tough one because, does the customer know best or do we know best? And I see it as an opportunity to educate people. And occasionally I've had people who are really not satisfied with the lighter pressure and they don't come back. And I often have a discussion with them as they leave that they have to find the best massage therapist for them at that time, but that they want to make sure that the person they're seeing understands the impact of cancer treatments and what that can do and how we have to moderate our treatment. Some people will get it and some people won't.
So you sounds like you have your own limit for how much you're comfortable using, and you find ways to talk about that. So I'm just wondering about the education process, how you help someone understand why you have the limits you do in a way that doesn't predispose them to feel like they're messed up, damaged, or flawed,
Yeah.
This is challenging. One of my favorite phrases that I use when I'm in that situation of speaking with a client is, your body is busy right now. And your body is very busy doing something that's important and vital, and I don't want to interrupt that. But you're right, Till. It's a delicate balance that requires a lot of inner understanding on the part of the therapist, as well as open presence in the treatment room. One of the things that I think also helps is I tell students all the time in our continuing education classes that you are not taking things away from people when you're adapting for their cancer treatment or their experience with cancer treatment. What you're doing is adding your knowledge, your increased knowledge that you have spent time and money to get, and you're giving this to people, because I think framing, if we go in thinking, I am taking away this deep pressure, I'm taking away this particular thing, then it's harder to have a conversation with the person in front of you and think of them as someone who is lacking or missing out. If we arrive in our wholeness, then we can also allow our clients and patients to arrive in their wholeness, whatever that looks like today.
I'm just thinking back again with my experiences with you, Loretta, how I don't really know. For me, it was, we had habitual ways of working before you started treatment that we had to adjust, but it really became a process of just really getting you to guide me in terms of the pressure you needed. And then, and taking it very cautiously, especially with the radiation phase, or all of it, honestly, but just to see how you responded, because I'm aware of the fact that, like a lot of situations, that how it feels in the moment isn't the only guide either. We have to see how you are later.
That's part of the conversation with the clients as well, to really stay in touch with them throughout the treatment, but also to stay in touch with them after the treatment. I usually email people a few days after treatment to see how they feel. And I ask them for any and all feedback because it will guide further treatments. And always tell them that we work cautiously at first, but then we can work less cautiously, but still carefully as we work together over a period of time. And I get to know their body and they get to know what massage does to their body as they go through cancer treatments, because that is the unknown.
Loretta, I hope you got my little autoresponder follow-ups with you to see how you're doing after our massages there. Do you have
any morning coffee?
That's right. Do you have any thoughts about this question we're unpacking here, Loretta? How do we modulate the pressure?
Yeah. I mean, definitely. I mean, I like what you're all saying. And Yeah, I'm fortunate that I have an in-house body worker, because I can say a few hours later and even a day or two later, like, wow, this is what I'm experiencing. And we can know that and work with that. So that's fortunate for me. But yeah, I mean, it depends on what's going on physiologically at the site, or other parts of my body in terms of depth and kinds of work. There's different kinds of work that I've chosen to do at different times, like, whether it's lymph work, or acupuncture, or body work, deeper light, or whatever. But I think, Rebecca, you said something about open presence. And I think that's really important. And I think maybe I'm assuming what you meant by that, but open presence, when you mentioned it, and correct me if I'm wrong, but there's something about that contact with the client or therapist with me that allows me to inhabit my body in a way to, in the moment, know what I'm feeling physiologically, and to, because it's a new territory for me too, right? And so the therapist can really help me by being in that open presence in terms of finding what I need, because, it depends on our personality typologies too. We might just say, oh, go do whatever, you're the expert, and hand over my power. But really, I think to empower the client is one of the most important things, because this is a journey. Cancer is a journey with a message, I think, and it can be so easily missed if we're not being attended to with that kind of presence, if you follow me.
Yeah.
I love it. Yeah.
And so physiologically, there's all this stuff going on, but emotionally too will affect the kind of touch that I'm needing that day. Like, I might have deep work one day, but the next day I'm in this dark, unmotivated, emotional place, and I can only have hands laid.
I'm picturing, we have this 5-level pressure scale from Tracy Walden. I'm picturing like a presence scale from Loretta, like pounds of presence or something like that, that we need to amp up in inverse proportion to whatever's going on there. So it's true, Loretta, that that's my biggest takeaway in my memories of having to do that calibration process in the beginning. Had to pay a lot closer attention in a way. And it really was a process of me paying attention, and then you inviting you to pay attention to, and having that dialogue in the moment that made it educational for me, made it work.
And it can be very empowering for the client.
Mm-hmm.
Yeah.
Because cancer is, and it might help a client realize cancer is part of my journey, my spiritual journey. Yeah. And, who am I? And, in that moment, can I really feel into who I am, what I need, and express that? That can happen in a session. That's a big emotional piece. And oftentimes, and I have experienced this, a client can feel missed emotionally, and therefore not get the physical attendance they need, maybe.
Do you have examples or ideas about how we could miss, or how you've been missed, maybe?
Oh yeah. So, I mean, an example would be for me, showing up at the office of the massage therapist who's busy and moving fast. And I'm like having treatment, I'm slow, I'm unmotivated, things are dying inside of me. I'm in a totally altered space, and I'm met with a pace that doesn't match me. And I either feel like I can withdraw, or I feel like I have to meet that. And so I have to come out of myself to meet that. And that's not really therapeutic, actually. That's not helpful. That's not me as a client making the time and spending the money and hoping for a connection, and then to show up and not be met in terms of emotion. Well, it moves into the emotional realm, and even physical, because maybe they're touching me too fast, or telling me about my experience, versus really coming in with the presence that I think Rebecca's talking about, open presence, and like feeling into what I need versus what they think I need, or just not being present. And that's like one of the biggest things, because I can end up leaving a session like really feeling missed and more emotional, and like, and almost like just missed and not seen, and not part of the world of the living, which you really feel when you're in treatment. You are removed from the world in a way. And so I think I'm getting more into the emotional piece there, but it's a big piece. It was a big piece for me. How am I being received, held, met? Not only physiologically, but emotionally, and maybe not physiologically if they're moving too fast and telling me what I need. I mean, I had somebody telling me to lay on my stomach, and I had a port in and I didn't want to. Oh, it's okay. You know, everybody does it. We can put the donut. I'm like, I really don't want to lay on my stomach. Find a way to work with it. You know, and I got a little bit triggered by that. And so I don't want to have to I don't want my client to have to get triggered emotionally in the session because they're already saying what they need. And I'm telling, you know, it's okay to do it a different way when I'm specifically saying, I don't want to lay on my stomach. Do you know what I mean?
I do. That's like
little things like that can just turn a person.
Well, there's all these tangible examples. Like I think this is part of your position factoring in your model, Janet and Rebecca. But it's all these are in a way metaphors or ways to talk about this process of meeting our clients. And for me, as a therapist, putting my agenda on hold enough to really sense where my client or partner or the person on the table is, and to see what they need, and to join them in some ways in that very unique, interesting universe they're in.
I'm really curious how we can instruct massage therapists in that and still stay very safely within our scope of practice, because I think what you're talking about is the magic of massage. I think that's where the extraordinary work really happens, but it's nowhere in my scope of practice, any of that.
Really?
And
what do you mean?
Our scope of practice is very much focused on the physical intervention of massage therapy.
Yeah.
But I do think that what Rebecca and Loretta, you're talking about is really massage therapy. I think that's where the extraordinary work happens. And how do we talk about technique and the safety of oncology massage and bring that other stuff into the awareness and still have the practitioner able to maintain a really clear therapeutic boundary so that they don't feel that they're the counselor and so that they don't go home exhausted at the end of the day. I think it takes a lot of finesse to do that, but I think it's critical.
Well, I think you're talking about bedside manner, and I would even like to see that in the medical profession. Just simple bedside manner.
Well, that's another story. But Janet, I want to maybe push back a little bit on what you said about scope of practice, because we're not talking. I don't think Loretta are saying ask about their spiritual path and make figure out what their emotional life is. I didn't hear her say that. I heard her talking about how we do the physical. If your scope of practice is the physical, doesn't that include how we do it? Things like pacing and things like the choices we make and the tone of voice we use, those sort of things. Aren't those part of scope of practice?
They are. I haven't read my scope of practice in a little while, but I think it's probably not the written part of the scope of practice, but it is, I think, integral to how we're trained to do our work. And when I was being trained, I don't remember too much of that. And yet I very easily brought that with me to the work. But I mean, I go for massages with different people all the time, and they're not bringing that presence. They're not bringing in awareness of me on the table and in that moment. So I do think there's something missing in terms of how we are taught and how sort of the entirety of massage is explained to us as we learn the trade.
Right. Well, I think that's exactly right. Like the way our scope of practice is written is all about, well, you can use these tissues and these parts of your body to work with these tissues, and you don't you don't open up any tissues with your, but we know in actual practice and in actual interactions with human beings, you cannot touch someone's tissues without also touching their spiritual, emotional, psychological being. And whether we're trained in that or not is part of what we really need to work with. And it's part of the challenge of just being human.
Yeah.
Mm-hmm. Mm-hmm.
And I'll just interject a little bit. I'm not suggesting that anybody, try to counsel. But
Right.
I think, I don't know if it was Rebecca or Janet who mentioned we have the tools and the skills for the work, the hands-on work, but there's some kind of awareness of client state and what might be going on that we can be present to without even entering that with them, without questioning it, without trying to take them anywhere, but just sort of a knowledge that, wow, there's a lot going on for this person. I mean, we would think that if we ran into somebody in the grocery store and they said they were going chemo, wow, your world is different than mine.
Mm-hmm.
And so just to hold that awareness of the client's state, and like you said, not knowing, there's a lot we don't know, but how do we just stay present with that?
I'm just remembering too that I'm remembering my first client early in my practice, first client I had who told me she got a cancer diagnosis, and what an impact that had on me. I was seeing her regularly, but the impact on me as the therapist too was it really sent me for a loop. I was upset. I didn't know how to relate to her. It did bring up all my associations with, does that mean she's dying? Does that mean, what do I say? Do I say my condolences? Do I say I hope for the best? I really didn't even know how to deal with all the feelings that brought up in me. What do you have? What guidance do you give people around that, Janet or Rebecca?
Attila, is so hard. It's hard, right? As many years as we've been doing this work and working with people who are going through cancer treatment or other chronic illness, it doesn't get any easier. First of all, that's the first thing that I would say to people, to just let's be realistic.
Okay, so it's difficult. It depends. It's hard.
Mm-hmm. And then what do you do? Right. So let's get practical. I hear it in your voice. One of the things that I try to guide people to do is to be aware, and this is something that we talk about a lot in Heal Well too, is to be aware of the stories that you are telling yourself. For example, your client that you talked about, till like the first person that you interacted with that you knew of, who had a cancer diagnosis, to just take a step back and acknowledge, okay, so now I am telling myself the story of how this client's this is gonna happen to them, and this is what the progression is gonna be like, and recognize that for what it is. It's a story. And to kind of interrupt that process of storytelling, because our brains will take us all kinds of places that are not useful in the moment. And to be able to interrupt that in ourselves and be like, okay, so that's a story. This is now. And to come to that blank space, for lack of a better term. And it's not something that can be taught in, a 3-day workshop or a 6-day workshop. It is something that is a lifelong practice. Mm-hmm. So we encourage people to have, do you have a contemplative practice, whatever that means to you, whatever speaks to you, a practice that really, where you are really sitting with and examining and understanding the workings of your mind.
Talking about a contemplative practice that gives you a place to reflect or to maybe understand that my feelings are my story.
Right.
There's a perspective on that.
Right. And gives you practice in doing that, because you can practice that on your own in whatever framework is meaningful to you, so that it's available to you more easily. The same way that we practice, for example, the physical techniques of our work, so that they're available to us when we have an actual client or person. So, what do you think, Janet?
It's such a complex part of our work. What I always try to do and guide people in doing is to stay with where the client is. So not go in the ups and downs with them, but stay where they are so that we're not bringing our own stuff into it, because we can bring our own fears. If a client has just had a new diagnosis, we can be quite frightened, like you were saying, Taylor. We can be very emotional if it's someone we worked with for a long time, but we really want to stay with them because it's their experience. And we don't want to bring our own stuff into it because that can be an incredible burden to them.
That's such an important point. I mean, I experienced that myself in various health conditions that I had in the past, but I watched that happen all the time with you, Loretta, where all the expressions of caring you get have a different impact, depending on their content, where they're coming from. And so many of them sitting back in this place are so well-meaning and yet have so much need for the sender in them. Yes. It's actually more of a request than an offering, in a sense.
Very much so.
How are you doing? Being a really complicated question, or what's going on with your treatment, or just the innocent unawareness of how big a question that is, in a way.
So actually, I'm curious for you, Loretta, is what how or if you can tell when someone is approaching you from a place of support and openness versus approaching you from a place of, I'm scared about what you're going through and I need things.
Yeah, I want to say something more than the energetic that I feel, but it is about, are they just being with me, or are they doing something?
Mm.
Do you know what I'm saying?
Mm-hmm.
So if I'm with somebody and it's how they're looking at me, it's their energy. Are they moving fast? Are they just being with me? Are they feeling like they need to do something, to give something to me? Or are they just being with me? I think it has to do with being versus doing. And just who I am, it's just an energetic thing. I feel like I'm not answering the question very
I got it.
Scientifically. Maybe you could translate, Till.
Well, yeah, I think it's back to the presence thing, at least what I'm understanding. You're saying, do you feel someone's being in them? Are they reading the text, or are they speaking from between the lines? Is there a spaciousness? Is there a matching your pace?
Yeah.
Is there a receptivity on that side, or is it just all one way content coming at you?
Right. And can they look at me and be with me and feel me, or do they feel like they need to do something with me?
Oh.
I've often thought that humans should be called human doings, not human beings, because we spend so little time being.
Right. Well, and it makes me just think of our culture and how we're trained, and how fast we're moving. And in my, in my treatment world, I'm way slowed down. And so it's really clear to me when somebody is like trying to do something versus just kind of sitting with me and feeling where I'm at.
Yeah. It's been a challenge and a gift for me to be with you through that, because I'm not in treatment, but I'm with you and still podcasting and doing all this stuff. And yet, going home and having to downshift, recalibrate. Okay, different state of mind, different state of being here. It's been a great practice. But I can see that being so important for a therapist too, to understand that every one of our clients is in a different state of being, and that there's lots of selections on our gear shift, and we might have to downshift at that moment to meet theirs.
Right.
All right. Couple other thanks for, by the way, Rebecca and Janet, for joining Loretta and I for our conversation about this. This is really nice to have this chance to catch up with Loretta too. What's realistic to expect from massage, let's say? What are some of the clear benefits that we can think of, or that we can help our clients reality check on what they're going to get out of massage and treatment?
Yeah, I'm not going to say it depends, even though I want to. because there are some things, and I want to plug again, and I hope Janet will talk more about this. One of the chapters that Janet wrote in the book is the wonderful research chapter, which has some really specific types of inquiry around massage and cancer treatment. But there are some effects, experiences that are somewhat universal or very common, no matter what your treatment is: pain, anxiety, nausea, depression, fatigue. And massage therapy can benefit all of those. I should say, adequately trained, appropriately delivered massage therapy can benefit all of those. And these are things that no matter what the specific treatment someone is receiving, they will probably have an experience of at least one, possibly more than one of these.
Give us that list again, Rebecca, if you don't mind.
Pain, anxiety, nausea, depression, and fatigue.
Yeah.
And the sort of more esoteric thing that I don't necessarily have research on, but is kind of I feel this is true thing, at least for traditional Western cancer treatments, there is necessarily a lot of approaching the body in pieces and parts. This is not an indictment of Western cancer treatment, because approaching the body in pieces and parts has been responsible for a lot of remissions, and a lot of people who are living today who may not have been decades ago. But where massage can step in is that we can be a sort of respite and sanctuary where your body gets to be whole, and your body as it is right now, with whatever is going on, is, well, to borrow from Sonia Renee Taylor, is not an apology. Your body is what it is, and what it is, it's been successful in getting to your massage appointment. It's been successful in living you through this day. So we get to acknowledge that wholeness, which is a little bit harder to codify, but it feels deeply important to me.
You're talking about just celebrating or acknowledging or being with the physicality that we are, just being in your body with someone else and having them attend to your physical being.
Yeah, and just having a space where there's a person, your massage therapist, your body worker, whose entire reason for existing is to be sweet to you, to be sweet to your body, to be kind and loving and attentive to your wholeness, your whole body, is really powerful. No matter what is happening in your life, it's incredibly powerful. Yeah.
And I can just interject a little bit there, like, all the things that you mentioned, the pain and discomforts of treatment can make you feel, touch can not only make you feel whole and sort of transcend that sort of discomfort state, but also it's like something feels good in the midst of feeling not good, because of the treatment. The touch can actually, it's a respite, but it also feels good it's great to have something feel good when you're not feeling good.
Let's underline that, because that does tend to get missed, I think, in our discussions of effects, that feeling good is not a small thing, especially if that's not available to other ways. It's like feeling good is plenty good. I'll take it. Great. Okay. I got so many questions. What's the hardest thing that you've seen our already trained therapists like me to get as they start to work with people in cancer treatment? Or what would you say?
I think the intake portion is really tough, because a client can come in with so many symptoms, and to figure out what might be causing them. For instance, a neuropathy could be from chemotherapy, it could be from radiation, it could be because they also have diabetes. There's a very complex medical treatment, is cancer treatment, on top of a complex body, which is what we all have. And to figure out what the client's bringing to us and what we can realistically help them with and what we can't. And knowing that clarity within ourselves, but also helping them to understand what the power of massage is, but also the limitations, which is where we can really help them to connect with other people, the integrative approach to find someone who can help them with things that they might not be able to address themselves or that we can't help them with.
In some ways, it's coming back to those benefits. And that's what I'm picturing. It's like my client comes in with a list of physical maladies that perhaps in other circumstances, massage or bodywork might be an indication for. In this special circumstance, though, it's a bit more complex. And yet for me, coming back to the fact that, well, if I can't necessarily help Loretta's neuropathy be diminished in one session there, at least I can find some way to help that be an easier experience overall.
Absolutely. Yeah.
Okay. Anything you have to say, Rebecca, about that? The hardest thing for already trained therapists to get?
Well, I'm so glad that Janet talked about intake. But the other thing that we see, which seems like it would be the easiest thing, but it's the modulating of the pressure. Not necessarily learning how to do it, but sort of owning it, for lack of a better term.
Breaking the habits that might not go along with that, in my case, yeah.
Exactly. And owning that you can touch someone what we call lightly and still have an effect that is profound. That's a hard sell in some workshops. And we have many experiences and many stories about the person who came in who was, sorry, Till, I'm going to say a Rolfer, or, who was used to heavy hands. And for them to sort of understand that they can work with someone with their hands being more gentle and sensitive in that way. At a 1, for example, on Tracy Walton's pressure scale versus a 4 or a 5 on Tracy Walton's pressure scale, and still the person will still feel benefit and feel better after the treatment. That's often very challenging for people to accept.
Yeah, it is. Yeah, in this realm and in others, I mean, that's a theme in our trainings for sure, that it's often the case that people come in used to working a certain way and used to using a certain level of pressure to feel the results, let them know that they're having an effect. So it is a recalibrating, whether or not you're working with someone with cancer or living with cancer, to really understand. You said something, Rebecca, about tissue. You said we're not changing tissue. I would, that's a big discussion in the field the last decade or whatever, maybe a theme in the podcast here, but I would say we are, at least, or especially maybe brain tissue or heart tissue. Or all of the different perceptive organs that are tissue based, for sure we're, impacting that tissue. And that's been a helpful model for me to realize that I can actually influence the experience someone's having in their brain and their heart and their being. And it isn't related to the amount of physical pounds of pressure that I use. It's more like the pounds of presence or something.
I would agree with that.
Oh, I thought so. Thank you.
I mean, pounds of presence, and also changing their focus, like with all the pain work that you've done, Till, working with people with pain. It's like, and so you're working with the brain, and it's like, if somebody comes in and they have a focus on what's going on in their body, you can actually help them change their focus by appealing to what they're focusing on, basically.
Okay, so anything else you want to underline around when we should refer, we've talked about that a few times along the way, but just anything else you want to make sure we say that when they should seek more training, when we should seek more training for ourselves? What do you think?
Always is the answer. The more we know, the more people we're exposed to, the more styles, the better practitioners we can be, I believe.
Always seek more training. When do we refer?
Well, first of all, medical emergencies. Sometimes people come in and they might have signs of blood clots and they might not know. So we need to know that so we can tell them that it's something they should have checked out before their massage happens.
Yeah.
Infections, poor tissue healing. Again, not everybody is really aware of what's going on in their body and what it signifies. So if we know a few of those indications, then we can really help people to get the help they need if there's a medical emergency. And also if something's outside of either our scope of practice or our comfort, which I do all the time. If there's something I'm not really that comfortable working with, or I don't feel knowledgeable enough, then I refer all the time. Rebecca.
You said it so well. I mean, really, yeah, I have no notes.
And I guess signs and symptoms of lymphedema as well. That's something that we should all know as massage therapists and body workers, so that if somebody has any indication that they might be developing lymphedema, that we can refer them to someone who can do an assessment of that. The earlier they get help with that, the less they might be impacted by it. So that's a really important one as well.
That's great. What thoughts do you want to leave us with?
This is the most satisfying type of work to do as a massage therapist, in my experience, because we have such an impact on people's physicality and their sense of well-being, and their ability then to go out and do more of what they have to do to get well, more treatments, more this, more that. I think we really offer a place for people to restore some of their energy. And I absolutely love the work.
Nice.
And sort of growing from that, I would agree with that it's very satisfying and on a like heart and soul level for me work. And it's not necessarily for everyone, and that doesn't mean that there's anything wrong with you. I think it is important for all body workers to at least have a basic understanding of oncology massage, because of the prevalence of folks who are in or been through cancer treatment, if only to know that this is not work that you want to do and you need to refer that out. So just really seek out an understanding of this kind of work. And if it doesn't appeal to you, then know that and act on it.
That's great. To acknowledge that what we are comfortable with, what we're not, and have that be okay. But then you mentioned prevalence. What is the prevalence? I think, just from memory, isn't it like 1 in 4 women deals with breast cancer specifically?
Mm-hmm. Yeah, it's very,
1 in 5 men deal with prostate cancer.
Right. It's in the book.
It's in the book.
but really, we can say, I think, with pretty high confidence that if you're a body worker for more than a year, you will absolutely 100% will have someone come into your office who has a history of cancer treatment, whether you know it or not.
Yeah, that's right. Okay. Loretta, anything you want to leave us with?
Now, I really like what Janet and Rebecca are saying about, scope of practice and referral and all that. And I just think, as a practitioner and as someone on the receiving end, it can just open up worlds if we are aware, like in terms of the skills that we need, but also it just can open up worlds of how to just really be present and have it affect our lives and our clients' lives.
Mm-hmm. Well said.
Yeah.
Wow.
Okay. Well, what would you put in part 2
of this?
If there was a part 2?
Oh my goodness.
What didn't you have time for that was important, or what do you want to expand some more?
There's so much. Yeah, I don't think we didn't really talk that much. We got to it a little bit at the end, but that much about like the prevalence of cancer treatment. And
Right.
I would love to drill down more into intake, like Janet mentioned, because it's so important. Like, you can only work with what you know, right?
Right.
Yeah.
The scope is important.
Yeah. And I would love to, now that you ask, I have 100 things. The emotional impact of this kind of work on the practitioner and the potential, the real potential for burnout.
Yes.
And emotional burnout, and how to manage that. Which I don't know if I know how to manage that. Ask me if I'm still practicing in 5 years, then maybe I do. But I think it's always a conversation worth having.
I think it's something we have to relearn daily, it seems.
Yeah.
I'd be interested in talking a little bit more about the practical applications. I work with so many people who, for instance, if a woman has had breast surgery and she needs to increase her range of motion in order to receive the radiation. Like, I've worked with so many women where manual therapy of some sort, whether it's physio massage, helps them to be able to get their body working well enough to receive the treatment they need to get rid of the cancer.
Yeah.
That's great.
Very
That's
practical things. And again, just radiation, but people have to assume all kinds of physical positions. You think of head and neck cancer and having the mask on and what that does to a person's emotions and psyche. And so some of that very practical stuff I find is very interesting for massage therapists. I know both Rebecca and I feel really strongly that there should be some oncology massage awareness in entry-level massage training, regardless of how long that training is.
Exactly.
Just because of the prevalence of the cancer rates, but also survivorship. There's so many people who survive cancer now, and yet they still come in for massage, and we need to know a little bit about that.
Absolutely. Right. Well, thank you, Loretta. Thank you, Janet. Thank you, Rebecca. Rebecca and Janet, if people want to find out more about each of your work, where would they go? Janet, let's start with you if we could.
Yeah, I have a website, focusmassagetherapy.ca. That's in Ottawa, and I answer all emails.
Focusmassagetherapy.ca. We'll put that in the show notes.
Thank you.
Rebecca?
Well, you can always check out HealWell at healwell.org. And again, I also answer all emails. We have online classes and an online community that are all linked from there, that you can connect with folks who are doing this and other kinds of work.
Wonderful. Thank you all for being with me today. Thanks very much.
Thank you. Lovely.
And
thank you, Loretta.
Thank you so much.
Thank you. It's so nice to be with you both, Rebecca and Janet. Yeah, thank you.
And on the way out, I want to thank Handspring, because when I was looking for a publisher for a book I wanted to write, I was fortunate enough to have ended up with two offers, one from a large international media conglomerate and the other from Handspring, which at the time was a small publisher in Scotland run by just 4 people who have a love of great books and of our field. To this day, I'm glad I chose to go with Handspring, as not only did they help me make the books I wanted to share with you, the Advanced Myofascial Technique series, but their catalog has emerged as one of the leading collections of professional level books written especially for body workers, movement teachers, and all professionals who use movement or touch to help patients achieve wellness. Handspring was recently acquired by Jessica Kingsley Publishers, where it joins their Integrative Health Publishing under the Singing Dragon imprint, and their amazing impact continues there today. Head on over to their website at handspringpublishing.com to check their list of titles, including Janet and Rebecca's book, Oncology Massage, an Integrative Approach to Cancer Care. Be sure to use the code TTP, the Thinking Practitioner, at checkout for a discount. Thanks, Handspring. Thanks to all of our sponsors. Stop by the sites, my site or Whitney's site for show notes. Whitney's site is academyofclinicalmassage.com. My site, advanced-trainings.com. If there are questions or things you want to hear us talk about, email us at info@thethinkingpractitioner.com or look for us on social media under our names. Rate us on Apple Podcasts. Look for us on Spotify, Stitcher, Google Podcasts, wherever else you listen. And please do share the word and tell a friend. Thanks, everybody.
I don't know. I went a whole hour without cussing. I'm kind of done with that.
Wow.
You
Not
cuss?
too late.
Quite a fucking bit. Yeah.
Oh, God damn it. I love it. Shit.